Good morning, everyone. I'm Dr. Tessa. So today I'll be talking about online game-based learning, GBL, on melanoma, the learning experiences of medical students. So the use of game-based learning, GBL programs in education is actually not uncommon and is increasing throughout the years. So it can provide education to audiences around the world, wherever their learning environment allows them. So not only does it provide opportunities for patients and interdisciplinary education, it works as a medium for promoting health professions. So it's actually essential to have critical, effective online education interventions with the increasing use of internet for health information. And all these GBL programs, they can also be used specifically for dermatology patient education, for example, education on malignant melanoma. And according to the Centers for Disease Control and Prevention, CDC, malignant melanoma actually is the sixth most common cancer among males and also females in the United States in 2016, which is the latest year for which statistics are available. So the state with the highest incidence is Utah and the lowest incidence is Texas. In general, for about every 100,000 of people, there were 22 reported cases of new melanoma cases and 2 deaths due to malignant melanoma. Thus, there is a need to create content that can help to raise and spread awareness about malignant melanoma to the public. There was also a research which was carried out by Nishita in 2018, which highlighted that it is imperative to improve malignant melanoma patient education materials through game-based learning programs as well as written materials. So my objective today is to present my learning experience when I was still a medical student, when I created this game for malignant melanoma without any prior skills in the development of this software or computer programming. So I'll move on to the methods now. The software which I use is called ChatMapper. Basically, it is a very user-friendly program which allows the creation of non-linear branching dialog trees. Okay, this shows an example of branching dialog trees. I'll talk more about this later. So it is a full-featured visual editor for managing the storylines. So all these dialog trees, they will imitate the normal interaction in real life. So the core is a lean, efficient conversation system. So numerous branching conversations were created, and this will allow the user to interact with a virtual physician who will then have a medical interview with the user and discuss with them the basic clinical features, risk factors, management, staging, and prognosis of malignant melanoma. And all this information are actually described in layman's terms to make the content straightforward, concise, and simple to understand. And all this information will obtain from Derma NZ. And for clinical features, they will be following the ABCDE rule for detecting melanoma. So after I design all these conversations, a conversation simulator will be used to present all the dialog trees as a game. And this will ensure that the game would work as intended in the final product. So what happens is, the game would start off with a very short question, which is a question by this virtual physician. The virtual physician will ask the user, "Hello, what brought you here today?" And after this, the user can select a range of options. For example, the user can select, "Doctor, I'm concerned I have skin cancer," or "Doctor, am I going to die?" Either response will lead to further responses, which are some of the examples here. And as the conversation continues, they can continue to ask the doctor about the staging, prognosis, the management, or long-term monitoring of melanoma, which actually helps the user to learn along the way. So all these conversations, they were designed with the help of on-screen buttons, menu options, right-click context menus, as well as shortcut keys. The layout was also fully configurable with interface elements and tabs. And to automate workflow to the maximum, the command line was used to automate the publishing and exporting process. And at the end, this project was published in the form of HTML5 player. The website was then created under WebNode, which is a free web page for unlimited time. And it was embedded into the website for easy viewing by the users. And after this, the users should be able to know more about malignant melanoma. So the aim of creating this is actually to improve the confidence of users towards skin cancer detection and identification, in particular malignant melanoma. It also helps to increase the level of preparedness of users to make appropriate dermatology referrals when suspicious lesions appear and when they have risk factors of melanoma. So, according to an article by BMC Medical Education, there are actually several important elements in the architecture of gamification. It will first start off with goal setting, followed by the capacity to overcome challenges, followed by the provision of feedback on game performance, reinforcement of information, comparison of progress, social connectivity, and lastly, fun and playfulness. So in short, when all these game-based learning programs are effective, they actually play a tremendous part to improve knowledge and skills acquisition and can provide repetitive learning experience and useful feedback. So I've chosen ChatMapper because it's a novel approach which helps to facilitate dermatology education, be it for patients, medical students, or any audience. And since the duration of our game-based learning program is only 6 minutes, it's practical to have a basic coverage of malignant melanoma, and the range and depth of the knowledge in our project is enough to help the users to learn quickly. And this is because many people nowadays, especially those who are working, they might face time constraints and can lose motivation and interest if the program is taking too long. And furthermore, for our program, the users can actually clarify any misconceptions with the instructors. So this will in turn improve the instructor-user relationship or even the doctor-patient relationship if the program is created and carried out in a hospital or clinic setting. So it's important to know that in general, game-based learning programs, they should be carried out in a safe environment, provide user autonomy and independence, and if possible, put a positive impact on assessment. It is also chosen as it's user-friendly and stylish, and the building blocks, they're easy to learn as there are no scripting required. This saves time and is suitable for people who wish to develop these programs without prior experience in computer programming. And a large collection of add-ons make it quick and easy to drop conversations into the project through the editor. And since this program can combine HTML5 text-to-speech with the web player to create those realistic conversations, it saves a lot of money and time on real voice actors. So this just shows that the success of any creation of these programs actually depend a lot on money and time factor. It also has a very straightforward navigating system which can accommodate users at all levels of computer literacy. And the browser and the HTML player works well. For example, using Internet Explorer, Google Chrome, Safari. It can also be exported to other game engines or learning systems. Some common formats include like PDF, JPEG, Excel, and zip packages. And if there's a need for more formats, there's a custom exporter creation service which is also available. And for e-learning integration, it can be embedded in Moodle, Scrum, Adobe Captivate, Articulate Storyline, or even Lectora. And after publishing the project online, it can be shared with anyone if you want to get some feedback or if you need some testing. Thus, it's actually preferable to select these softwares which are user-friendly, which are compatible with most devices and internet browsers, and also have e-learning integration. as well as exporters for common formats. This project actually also tailors to users with good proficiency in English. So even though multiple languages can be defined for the dialogue trees, the main language is still English. And of course, you can opt for different languages which suit other users. It's just worth taking note that the language which is most well understood by the audience would have the maximum learning benefits for the audience. So since this project is not a one-time game, it can be played as many times as the users want, depending on the personal motivation. So if they play the game more than once, they will have a repetitive learning experience which helps to reinforce their knowledge and learning objectives. So even though game-based learning projects bring a lot of advantages, there can also be some areas to look at when you want to create game-based learning programs. For example, for our game-based learning program, it does not provide context for feedback or recall. So this might be some areas to look into. So moving on to the limitations. First of all, some engagement factors are lacking, for example, surprise and reward, and it also has a high pricing, which is not that favorable because there are some other softwares which are more also expensive, but in general, game-based learning programs, softwares are very expensive, and it might not be compatible with all your devices. So there are some engagement factors which we should know, which includes safe learning environment, prize, surprise, excitement, fun, and even pride in achievement or accomplishment. But ultimately, all these factors will depend on the type of software and content which the developers choose to deliver. Other than that, when creating game-based learning programs, it's important to involve the senses of all the users, which includes their eyes, their ears, their touch, and their mind. This can be in the form of music or colorful illustrations, which can generate excitement and spark the imagination of the users at the same time. So this helps to make the users more motivated to complete the game. So the disadvantage of game-based learning programs are only mentioned in one citation, and it is due to the competitive nature of the game, which intimidates user, and this element is not present in our game-based learning project. All right, so it is also established that there are a few factors which can become barriers for participants and barriers to prevent the implementation of this program. This includes lack of enthusiasm from the participants, organization culture, time factor, cost factor, and some engagement factors, for example, cognitive skills or interaction skills, and lastly, lack of cooperation of users. Just to add on, some of the cognitive skills can also include problem solving, decision making, active or deep learning, mental challenge, or knowledge reinforcement. Of course, the engagement factors will also depend on the interaction skills, and interaction skills includes collaborative, cooperative, interactive learning, competition with peers, and also peer learning. So when a game-based learning project is straightforward and also has all the other strengths, there's actually less significant chances for the game to fail. And it's also important to note that some users might not actually want to be involved in the program because of their own anxiety or fear of embarrassment or rebuke if they do not complete the game. If they get bored, that might also lead to the users not completing the game, leading to demotivation and also quitting. And when the contents are too wordy and too serious, it can lead to the loss of gaming characteristics and subsequent loss of enjoyment. So the overall game design is another factor to look at. So in conclusion, physicians may actually consider integrating all these GBL programs into routine practice so the patients can have a better understanding of their own disease or even common diseases like malignant melanoma. However, the development might be hampered by time factor, cost factor, and the need of technical experts. And to better understand how these programs could be used in dermatology education, further research should be carried out to investigate the most motivating and engaging factors, as well as the type of content best suited to be delivered to the targeted audience. And in reporting my rationale, I just hope that all these can help other healthcare professionals to employ the advantages that game-based learning programs has to offer. So these are my references. Thank you so much.